We have a very important guest on the program today talking about a very important subject, how hospital safety failures harm people and raise costs and what employers can do about it. And joining me to talk about this today is Leah Binder, CEO of the Leapfrog Group. Lee, good morning to you.
Good morning.
Hey, sorry you're having trouble getting connected with us. That's a difficulty in Atlanta and D.C. sometimes. but glad to have you with us. You deal with some very, very important issues, and talk to us about hospital safety failures and the danger to employees and their families and what employers can be doing.
Well, great. Thanks for having me on. I do think
welcome.
This is a really critical issue for employers to focus on. They have a lot to focus on right now, but I want to make the case that this ought to be a priority, even given the many changes coming down the pike with the Affordable Care Act and other regulatory changes. This one is really significant. 1 out of 4 people who are admitted to a hospital will suffer some form of unintended harm. So I'm not talking about whatever it was that got them in the hospital in the first place. So I'm talking about an injury or an accident, an infection, some kind of harm. In some cases, very serious harm. In fact, 1 in 6 times it's a serious harm. And about 500 people every day die from these errors and accidents and injuries. These numbers are astronomical. I think many employers may see some of this buried in their claims forms, and perhaps they think it's just a fluke, or it's just them, or maybe it's something that they can't really see that clearly because it's often embedded in, within medical records, and it's embedded in claims in such a way that it's hard to see all that, but it's happening. And what is also significant about this is it happens differently at some hospitals than others. And what we have found is that there can be 6-fold difference between the rate of injury in one hospital as opposed to another, and they can be in the same community. So it's in the interest of employers to really look at this and see how they can at least advise their employees as a first step on which hospitals seem to be doing better than others so that they can literally save their lives, certainly save their health in many respects, and, of course, for all this, there is very substantial cost implications for employers.
Lee, one of the things that we were talking about earlier is that employers really can't afford not to look at everything from a cost standpoint because they're looking at ways that they can lower their cost. I come from a family of nurses, so they all, my mom's a nurse, my wife's a nurse, and so I hear this discussion at the dinner table all the time. But what should employers do to protect their employees from unsafe hospitals outside of just knowing which ones might be the best ones for them?
Well, the first thing they can do is advise them. So, and actually there was an interesting report, a white paper done by the Alterum Institute, which you can get on a link to it from hospitalsafetyscore.org, which is our Leapfrog's new initiative, which gives a letter grade to hospitals, rating them on their safety. Mm-hmm. But Alterum Institute looked at what are some options for employers on using what information we have out there to really advise employees or also to drive employees toward the better performing hospitals. And so that paper, I think, has some nice layouts. But the first thing they say, of course, is advise. So open enrollment periods or other times during the year, any employer can simply give employees information that explains, that shows them which hospitals, which doctors, et cetera, are performing better. In the case of hospitals and hospital safety, the hospital safety score is your best bet. It's the only rating that focuses entirely on safety. It's done by employers. Leapfroggroup.org and Leapfrog, which is my organization, is an employer-driven nonprofit organization. And as a result, we've been committed for over a decade to transparency and driving markets in healthcare. And so you can take a look at that. It gives you not just information about the letter grade that our experts assigned to hospitals based on their safety, but also on how we derived it. So you won't find that either. We're so transparent that we'll tell you how this hospital did on the 26 measures that we looked at for that hospital. So this is a free It's free to anyone, so it's hospitalsafetyscore.org. You can search hospitals. There's also a free app, and it's all a public service brought to you by your colleagues, other purchasers who feel strongly that this is the kind of information they want for their employees to know before they need hospital care.
So, Leah, very easy for employers to provide accessibility to the Hospital Safety Score. Simply provide a link, and there's the knowledge that's there.
Exactly. They can go, again, to hospitalsafetyscore.org. They can search by their zip code, by their state, by their wherever. It's national. Most employers have, or a lot of employers have employees in more than one state. This is a national score. Again, it's our governance is purchasers. Their interests are yours. So strongly encourage. It's all free. And again, the app is both on iPhone, iPad, and on Android. So it's readily accessible, and it's really neat. I mean, it's a very easy-to-use instrument. Some employers would like to use the hospital safety score on their own materials, so branded with their own company's name, give that out. A lot are interested in doing that. And that's free as well to purchasers who are members of Leapfrog. You'd have to join Leapfrog to do that, but we welcome that as well, and we certainly need a lot of engagement by members to make all of this happen. But the bottom line is all of this is available. It's a public service, and it's extremely important that employers focus on this because, with the advent of consumer-driven healthcare, with higher deductible health plans, et cetera, what our employers are going to notice when they convert to these plans, first thing they're going to notice is that the claims that they're paying are increasingly coming from hospitals. Even now, it's roughly, on average, 50% of the claims that employers pay come from hospitals. In the future, of course, now that employees are going to pay more of their out-of-hospital costs themselves, the claims you're going to see are going to come from when they exhaust their deductible, and that's going to be when they have an inpatient stay. So it's increasingly important to focus attention on the performance of hospitals. And again, there's a lot of opportunity, a lot.
Now, Lee, many employers are spending growing resources on maternity care. Can Leapfrog help with that?
We certainly can. That's not an area that we look at in the hospital safety score as much as, although, actually, I shouldn't say that because anyone who is admitted to a hospital to give birth is subjected to the same kinds of threats of infection and injury that anyone else admitted to a hospital has. So that is a certain area to look at. But in addition, we have the Leapfrog Hospital Survey, which is a separate initiative, also done by the purchasers who are members of Leapfrog, also free information. It's a survey. We ask hospitals to report information to us, information that purchasers want but can't get anywhere else. And there's quite a lot of that, believe it or not. And even in today's era of transparency, it's very hard to get good information on how hospitals are doing unless we just ask them for it. The reason many report is because purchasers are asking. If the largest employer in your community asks you to please report this information, that tends to have some persuasive impact. So we are able to get data across the country. And we do have a section in the Leapfrog Hospital Survey, new section on maternity care. One of the things that we've been reporting on now for 3 years that's actually a very big priority, I know, for most purchasers that I know, is early elective deliveries. And these are deliveries done they're scheduled between 37 and 39 weeks gestation, which they shouldn't be scheduled then unless there's a compelling medical reason. And so if they are being scheduled then often the baby is far more likely to end up in the NICU with major problems. Obviously, all this costs a lot of money. It costs a lot of heartache as well, as you can imagine. These babies are much more likely to die at birth. There's major complications, and they're completely unnecessary. So we ask hospitals to report to us on the rate of early elective deliveries, and even though this has been a big priority for March of Dimes and the medical specialty societies, et cetera, for years, we haven't seen progress on this measure until Leapfrog started publicly reporting by hospital. So we're pleased to say that that's had an impact to have the transparency, but still, big variation. There are some hospitals that have, 20, 30, 40% of deliveries early elective for no reason. At the same time, I'm pleased to say about half the hospitals are under 5%, which is where you want them to be. So it certainly behooves any pregnant woman to take a look at Leapfrog data to see how the hospital is doing on early elective deliveries. And we do have some other measures around maternity care as well that they need to look at.
It's a very interesting, all of this, from your safety scores to here on maternity. And time flies when we're having fun, Lee. So I want to give you a chance to kind of take a minute or so and give our audience some clear takeaways and how they connect with you as well.
Well, it's important that employers take a good look at their spend in the hospital inpatient side. It's probably quite a lot of their spend. It's going to increase, especially if they're moving toward high deductible health plans. And there are things they can do now and right away that cost them nothing, that other employers help build for them. And I encourage them to take a look at leapfroggroup.org or hospitalsafetyscore.org to take a look at how they can immediately and at no cost plug into ways of helping their employees get the safest, most effective care and driving a real market for cost-effective care and safe care in their community. There's lots they can do, and this is an area that we welcome their input with.
All right, Lee. Thank you so much for joining us this morning. And you can also find access to Hospital Safety Score and Leapfrog Group on the IHC website, because she is an association partner, and we're glad to have her there with all the important information. Well, you enjoy your weekend, and to our audience, stay tuned for the next segment of HealthCare Consumerism Radio.